as most people know, the VISION study was a study of lutetium PSMA-617, which is PSMA-617 is a small molecule that targets PSMA. Lutetium-177 is a beta emitter. This was a late-stage pretreated patient population designed to be post-potent AR and chemotherapy, mostly patients with all available chemotherapy done, although one of the entry criteria could have been ineligible for cabazitaxel. But basically was standard of care other than radium or cytotoxic chemotherapy. So mostly AR targeting agents, but it could include steroids or extraluminal radiation or things like that. So it was randomized at that standard of care with or without. So it was a kind of a 2+1 type of study in a 2-to-1 design with dual primary endpoints of rPFS and OS. And the bottom line, and this was a selected patient population with PSMA-PET. Although for those that are familiar with a therapy study, the criteria to get in were much less strict. And I think that's reflected when people look at the results of who was excluded for not having PSMA positivity. It was a small minority in this study as opposed to about almost 30% in therapy. But overall, as I think people know, a positive study. So both rPFS as well as overall survival were improved. There was more toxicity in the 2 treatment, meaning lutetium-617 plus standard of care had more AEs than standard of care alone. That's not surprising because it's 2 versus 1, and patients were on the dual arm a lot longer than they were the single arm. So overall, I would say it confirms what, at least in my biased viewpoint, many of us expected, that this type of an approach will work. So my hope is that that will lead to worldwide approval of the agents in a way that's accessible and paid for by whatever kind of insurance is available in each country. And this particular drug, as well as others, are now moving in earlier lines of therapy in randomized trials. So there are actually at least 4 that I know of phase 3 trials that are either much earlier lines of therapy, such as the AFT53 PSMA addition study, which is frontline hormone sensitive, ADT plus AR pathway inhibitor with or without lutetium PSMA-617 upfront versus at progression. So it's a crossover study with an rPFS endpoint. There are 2 studies in that initial post-AR setting, one with 617 and one with PNT 2002. That is a trial in progress that's being presented called SPLASH. And then lutetium J591, aka TLX591, just launched a study in Australia that's coming to the United States one step later in terms of post-docetaxel. So it's great that we have now 2 randomized trials that are positive, a phase 2 and a phase 3. And hopefully that's going to lead to an approval. And this is on the heels of imaging approvals. And hopefully the additional phase 3s will